Welcome, Maddy. Thank you so much for joining us for the Compassionate Women's Health Community practitioner interview.
Thank you for having me. I'm very excited.
Yeah, it's so good. I love bringing in practitioners who have a special interest in women's health. So I met Maddy at the Quendo long lunch at the start of 2020. So it started, 2021.
Yes.
It's supposed to be 2020, but COVID delayed it for a year, and so we finally had it, and it was a great lunch. So we were sitting beside each other, and so we've stayed in contact, and I've finally been able to get her to come on and interview in the group, which is lovely. So Maddy Walker is a qualified acupuncturist and natural health enthusiast. She is a registered health practitioner with ACMA and AHPRA. Maddy believes that the healing abilities of Chinese medicine are unique, just like every patient who walks through the door. She uses gentle techniques that are effective and nurturing, and is passionate about helping her clients reach optimal health and well-being through natural medicine. Maddy always has a smile on her face and believes that bringing happiness and kindness into the clinic creates a nourishing environment for healing. And I can attest to always seeing Maddy with this beautiful big smile on her face.
Oh, thanks.
Loves treating any condition under the sun, with special interest in conditions such as women's health, fertility, musculoskeletal, digestive, and cosmetic. Maddy has been involved in numerous collaborations with women's health fundraisers and non-for-profit organisations. She is especially passionate about spreading awareness of women's health and offering natural medicine solutions. Now, I'm particularly interested in this. She is trained in the Fertile Life method, offering treatments that are specially tailored for fertility patients and women suffering from endometriosis, PCOS, and other conditions affecting the reproductive system. She likes to incorporate a variety of dietary and lifestyle advice in her sessions, which may also include herbal products to help assist the treatment. Her compassionate, easygoing nature and vibrant energy makes patients feel comfortable and supported throughout their whole treatment. Maddy draws on her own health journey with endometriosis and uses this in a positive way by being able to connect with people who are going through the same health issues or seeking more answers. She understands how emotionally, physically, and mentally taxing women's health conditions can be, as many of us in this group do, and is passionate about combining her knowledge and personal experience to create a treatment plan that will improve her patients' health. Good to have you.
Thank you for having me.
So as you would have guessed, Maddy is a traditional Chinese medicine practitioner, and most people will just call you an acupuncturist, but really it's so encompassing, isn't it, across that broad spectrum?
Yeah, absolutely. So acupuncture is one of the, methods of treatment of traditional Chinese medicine. And then we have things like the herbal products that we use. We use moxa, so things that we burn, cupping, gua sha, lots of other tools as well. Acupuncture is a big treating method, but yeah, it's all encompassing.
Yeah, definitely. Cupping, when I first discovered cupping, I was pregnant, I'd had a cold, and so I couldn't use any of the traditional, sinus cleansing medication.
Yeah.
And my acupuncturist did cupping on my back to draw out the cold.
Yeah.
Phenomenal. It just worked so perfectly. So I've been a huge fan ever since.
Oh, good. It works amazingly. And actually, since the Olympics and a number of years ago, and seeing the swimmers with the cupping marks on their backs, it's gotten a lot more popular, and people are like, oh, this stuff works.
Yeah. So can you share a little bit more about your modality and how it works?
Yeah, absolutely. So one of the main things I like to point out about traditional Chinese medicine is that it's over 2,500 years old, and it's stuck around and been implemented in the Western culture as well, and is used in hospitals in Western countries too. So I like to bring that to people's attention, because a lot of the time you hear the word placebo and things like that. And I just like to kind of point out that if it is only placebo, it wouldn't have lasted that long, wouldn't be used worldwide, and be used in hospitals too. So I like to point that out.
Definitely.
But what is so amazing about Chinese medicine is it's a holistic medicine. So it focuses on the mind, and the body and the spirit. So we basically look at treating the body's physiological imbalances by regulating what we call qi, which is our body's like vital energy, and it nourishes all of our organs and our systematic pathways. So we want to make sure that the qi is in harmony. There can be disharmonies with different organs, and then we treat the qi associated with that organ.
So do you want to give us an example of one of those? Like say
Yeah, for sure. So for example, this is very common for lots of people. There is a pattern called liver qi stagnation. And this is very common in people who are stressed. And the emotion of the liver, because each organ in Chinese medicine looks after a certain emotion. It is irritation, frustration, anger, stress. And so when we have lots of that stimulus in our life, the energy in our liver gets all stuck. And then we tend to have things like we lash out, our muscles get all tight because our liver in Chinese medicine feeds our muscles with nourishment of qi and blood. So we have to use the liver meridians and acupuncture points to treat that pattern. So that's kind of like a little description of how it works.
Yeah.
But in a Western sense, I do like to explain it from that side as well, because Chinese medicine can be a bit confusing to understand. So basically, when an acupuncture needle is inserted into the body, it triggers the release of ATP, which is basically a form of energy, and it creates a tiny amount of trauma in the right spot, which stimulates basically organic chemicals that have analgesic effects. So like helping to decrease pain and local inflammation. And yeah, there's studies that show that like after 30 minutes of acupuncture, the concentration of that chemical in the body had risen to 24 times greater than the baseline. So that just kind of shows like the body's own ability to treat pain and inflammation with the use of acupuncture.
Yeah. I actually was listening to an interview the other day, and the interviewer was talking about that how pain and pleasure are pretty much in the same area of the brain.
Yeah.
And they actually mentioned acupuncture.
Oh, cool.
Yeah. And how, because he was talking about when, like talking about addiction as well, and how people, addiction, when they're addicted to a drug, they'll be, that pleasure center has been so overstimulated, it doesn't respond anymore. And so they almost have to like stimulate the pain to be able to come back to pleasure. And they were saying they sort of wonder, there's a theory that that's kind of how acupuncture works, in the fact that that little bit of pain will help kind of balance out that pleasure principle and bring that. I'm not explaining it very well.
No, yeah. That's so cool. It's really interesting, isn't it? Like just, very similar connections and like feedback loops in the brain. That focus on, and especially, like you said, like those areas of the brain being so close together.
Yep.
Yeah.
Yeah. Is there anything else you wanted to add there about acupuncture and TCM?
I think as well, like I'll probably talk a bit about the inflammation side of things. So we have like the pain, it helps to release analgesic chemicals, which is pain relieving chemicals in the body. And that's how it works for pain management. But for inflammation, like injuries as well, or for women's health conditions like, endometriosis, painful periods and everything like that all the swelling and so basically it helps to release endogenous chemicals that are made by the body naturally. So it also helps to trigger an axon reflex, and this is where the body releases red blood cells, white blood cells, histamines, and other like biochemicals that help to trigger a response of inflammation. So it's kind of like creating a little bit of inflammation in the body to release the red blood cells that then have to fight it back. So it's kind of like a little bit of a, here's a little bit of something for the body to react in a large way. And then and then fight the bigger picture of the inflammation. So that's kind of another way that it works. But basically, the aim of traditional Chinese medicine is to generate nutrient-dense oxygenated blood and move it to every part of the body and every organ. And then in our eyes, it means that the qi and blood and all the vital substances are flowing smoothly through all of the channels, which means that everything is being nourished well. But yeah, I do like to point out like the holistic side and how emotions can cause disease can cause emotion, and it can just be a big cycle. And that's what I love about it, is we acknowledge the emotional component of life and of diseases and how they affect your body, whereas they're not really recognized as much by other disciplines like GPs and stuff like that. But there can be really root causes of trauma too that can cause a physiological effect in the body, and we like to treat that root cause.
Yeah, definitely. That's awesome. That's really powerful. And so how do you bring herbs in?
So with the herbs, when a patient kind of walks through the door, we talk to them, figure out what their signs and symptoms are. We read their pulses, which tells us what the state of their organs are. And we have a look at their tongue as well, and it also does the same. And then we kind of create a Chinese medicine diagnosis. So we say, you have liver qi stagnation, like what I had talked about before. We would use the appropriate acupuncture points to treat that. And then we would prescribe the appropriate formula that helps to do the same things that the acupuncture does, but it's an internal medicine. So it's kind of like, kind of like giving you everything you need to fix that pattern. And so there's herbs that are really good at soothing the liver. There's herbs that are really good for emotional turmoil, really good for moving blood and circulation as well. So like we have to look at the pattern that we diagnose you with and then relate those to the appropriate herbs.
And the one that comes up for me every single time for the last 12 many years plus that I've been going to acupuncture is my spleen. And that's that's the holding up. So like, for example, when I was diagnosed with adenomyosis, the symptom that I had with adenomyosis was spotting. And so I go home with my moxa stick to do my moxa points for the spleen.
Yes, good.
And it was interesting. And like, you know, we're all women here. We can share. I'm sorry for some of you, this is a bit too much information, but when the bowels are loose as well, what I didn't realize is that spleen as well, because it's loose, it's not holding up. And so when my acupuncturist said, oh, you know, you'll see your stools, you know, becoming a bit more formed, I was like, oh, that's spleen as well, because I'd been in such the mindset of the women's health aspect of the spotting that I hadn't even thought of the digestion, but it's all about that holding the energy up, isn't it, with the spleen? And
yes, exactly. And like what you said, it's not just for one area of the body, it's the whole body, which is why it's so amazing at like treating the whole person. It's like the bowels, it'd be things like the bladder as well with urine and like a frequency of urination too. And then like the spotting, you'd probably also notice like bruises as well. So people who have weak spleens, they bruise because the blood vessels don't hold the blood in very well. So they get damaged easily. So then you probably notice you don't get bruised as much. But yeah, it's really, really interesting how it affects the whole body. It's not just like, this is one part of my body that is affected. It's everything. It's really cool. But the spleen is a common organ associated with women's health conditions. Definitely. It looks after the thyroid in Chinese medicine. So a lot of hypothyroidism and the relationship between the brain and like the ovaries, the HPO axis.
Yep.
So we treat the spleen with that as well, because there's
for those people who don't know what the HPO, that's the hypothalamus, the pituitary ovary connection.
Yeah, that's correct. Yeah. So basically the brain telling the pituitary gland to release certain hormones to the ovaries to help mature an egg, release an egg, everything like that. But yeah, so then, if for example, ovulation isn't working very well, then we kind of treat the spleen because the spleen looks after that whole connection there.
Yeah.
Yeah.
Progesterone would link into that because that holds the pregnancy up and everything. So yeah, interesting, isn't it? It's all connected.
It's all connected.
And I love how you spoke about, and this is, where that holistic approach comes in with the diet as well, because, for example, with the spleen, it's those warm foods, nourishing the body and helping with that as well. So it really is that big picture, the whole picture.
Yeah, exactly.
So tell me a little bit about your story and how it led to moving into traditional Chinese medicine for you.
Yeah. So my parents actually got acupuncture a lot before I was even born. So dad was into his sports and he went to alternative medicine and used to get treated for those injuries. And then when it came to falling pregnant, mum and dad went and saw an acupuncturist and a Chinese herbal doctor, and that helped them fall pregnant with me, which I think is a really cool little loop around. Yeah. And it actually turned out that their practitioner that treated them ended up being my lecturer at uni, and we made this really cool connection. It was really funny. But it was a nice little way of being like, I think this is what I'm meant to be doing. Yeah. But yeah, I always used to go and get acupuncture for like injuries, because I did lots of dancing when I was younger. I would go see physio, but I'd find more relief from acupuncture treatments. If we're sick or anything like that, mum and dad would take us to the clinic. And I really, really loved it. The only issue is that it wasn't spoken about in school when you're meant to kind of have a think about what your future holds and pick the course you're meant to do. They don't talk about natural medicine courses. So for some reason, it just didn't come into my mind, and you're kind of forced to pick something. I started studying psychology at UQ. Didn't last long because I just wasn't the right atmosphere for me, and it just didn't sit completely right. So I had a year off, and I started working at reception at a natural health clinic, and I was just seeing the way that patients were coming out all happy and how amazing the practitioner's day was at work. I'm like, this sounds awesome. It smells really good too. It's nice music. And so then I looked up how to study acupuncture, and there was an open day that Sunday. And so I went and then ended up signing up that Sunday, and it was like just all happened very quickly. But so that's kind of how I came around to acupuncture. But my focus for women's health came from my own like personal journey. So for probably about 6 to 7 years, I experienced very, very painful periods. This was after coming off the pill in my early 20s. And it just gradually started to get worse and worse and worse. And I came off the pill because I started studying and found out more about my body and medicines and what it was doing to me. So that was my personal choice. Stuff just didn't feel right. Go to my doctor, tell them that I've been having like these weird fainting attacks too, and like vomiting and, like upset bowels, and get these like pain episodes where I'm sitting on the toilet for an hour and I can't really move. And she's like, oh, you just need to go on the pill again. And it was constant, kind of like felt like I was hitting my head on a brick wall. Like I just couldn't break that barrier. Didn't get any referrals. I said, can I have a referral? And no, they'll just tell you the same thing I'm telling you, which is to go on the pill. And, I got and then there was an episode when I was in uni, and now I think it was an endometriosis flare or a cyst rupture. They weren't too sure. So I went to the hospital. My lecturer actually ended up driving me there with one of my mates at uni, and got a referral from them to go see a gynecologist. And this was probably my second encounter with a gynecologist, and very, what's the word? I guess vulnerable, and having an internal ultrasound done, and then just being told, oh, this is just a dog's breakfast in here. This isn't what a woman's body is supposed to look like, and saying all of these comments that just aren't appropriate at all, and have stuck with me for quite a while. And that is definitely a part of the, I guess, emotional trauma that has come up for me.
Yeah.
And so it took a while for me to be able to go back to gynecologists and specialists. But last year, it just got to the point where I was getting nowhere with my doctor, and I basically said, like, I'm requesting that you send me to these people. I want a referral for each one of these specialists because I've been told that these people are really good. I shopped around about 4 or 5 specialists, and I found one that was up to date with the latest information about what endometriosis is, the latest research, and was extremely considerate of my feelings and considerate of what I want to put in my body as well. And he said, I suggest this, but it is completely up to you. I'm not going to force you to do anything. You have to be okay with the decision that we make. It's completely up to you. And went down the journey of having a laparoscopy and got diagnosed with endometriosis last year. And I think that whole journey of finding my diagnosis and going through this has definitely made me so passionate about treating other women who have these conditions, and women who struggle with fertility because of these conditions as well. So that's where my focus is. I love treating anything, but I'm very passionate about women's health and natural medicine treatment, because that has also really helped me manage my pain too, and my recovery as well. So that's kind of how I've gotten to where I am. And I think because I've gone through it myself, I'm able to sympathize and understand at the same level that my patients are. So I'm just very passionate about them getting better. Because I know how much it sucks when you don't get anything out of a consult or a treatment with a health professional. Yeah,
definitely. And they can work really powerfully together, because
definitely
that medical intervention, because of at least 6-7 years of that build up of the symptoms, the medical intervention, that laparoscopy can go in and get you to that clean slate point where the traditional Chinese medicine, or whatever your complementary therapy of choice is, will then take your body and help you sustain that. That's what I found. Exactly.
Yeah, that's exactly what my aim was for myself as well. And to try and, it takes you back to kind of like that base level where, they say like the tissue has been taken out, and it's keeping the body at a state of lower stress, and like lifestyle changes as well, and in Chinese medicine, treating the condition. So what do you present as that day? What parts of your body do we need to work on? And then bringing you back to basically that homeostasis level, so that optimal health and well-being level. Yeah,
beautiful. So what are some of the common threads that you see with your female clients? Like, what are they coming and presenting with and needing assistance with?
Yeah, so it is a lot of women's health conditions like endometriosis and adenomyosis. It's pain management, stress and anxiety around it as well. So the anxiety around having their period, or the anxiety around having the IVF procedure, and bringing that body out of the sympathetic nervous system, which is all that fight or flight, and bringing it back to parasympathetic rest and restore, because our body doesn't do the functions it needs to do if we're in this running away from a dinosaur state. It it will go, you know what, your period can wait. We need to run away from the danger right now. So we're just going to pop those things on hold. Your digestion can wait. We're just going to pop that on hold. So bringing you back into that calm state and allowing the flow of energy, or the flow of blood to all the organs. So it's mainly the pain management. And yeah, fertility treatment as well. Lots of people who have been trying to conceive for over a year or so, and not being given the right supplements as well, or just being directed to take the general preconception supplement that's got like lots of synthetic things in it too. You want the activated forms of things because it's better for your body to thrive on. And I also get lots of people who come in with associated symptoms with like PCOS as well. So acne, I treat lots of skin conditions too, and weight as well, and the thyroid. So that is probably about like 85% of my patients. Others are injuries and stuff like that too. Yeah.
So tell me about this, that fertility method that you specialized in. What does that entail?
Yeah. So there is a Chinese medicine doctor in Melbourne who has created this fertile life method. And I've done a bunch of her courses and gone away to Melbourne and done like seminars and everything, learning off her. And she has put together pretty much all of this information for complementary practitioners to present with their patient who is going down the fertility journey. And it's kind of called like the fertility detective. So we go through every single thing that could possibly be wrong to try and find the root cause. So it's not just, oh, it could be this, it could be that. It's no, we're actually going to go through every single thing. We're going to request that you go and get these blood tests done. We request that so it's really breaking it down. It also goes through like optimal herbal products and herbal formulas and acupuncture points to treat women. It's a really good understanding of as well, like connecting with specialists and doctors and our role too, and like communicating with them. But yeah, it's basically just a big training in fertility and how to try and find out why someone might not be falling pregnant when it's been going, they've been trying for about 12 months or something. If they don't want to go down the IVF path, well, then we also have to like break this down and look at every single thing. And also with the partner too of the opposite sex, breaking that down too and getting them to come in. So it's just really detailed, I guess. Yeah.
Yeah, fantastic. Awesome. So across all of those fields that you've been dealing with, from the women's health, what's a couple of, or one or two success stories that makes you really light up?
Yeah. Obviously, whenever there is a successful pregnancy and a birth for one of my fertility patients, it makes me very, very happy. And I get the little photos of the babies and it just like makes my day. But there's two stories that kind of stick in my mind. So I have one patient who was diagnosed with stage 4 endometriosis in her early 30s and told probably won't be able to have children, and had adenomyosis as well. And I was treating her for probably about 6 months to a year for like pain management and symptom management of her periods. And then one session she said, we're thinking of starting to try to have a baby. And I was like, that's awesome. Like, we're going to get you on the right supplements that we need you on. And then I saw her, I think it was 3 weeks later, and she said, I'm pregnant. And it was like just one cycle of trying, and she fell pregnant straight away. And she was like, I was not expecting it to happen this fast. And she's actually just had the baby about 3 months ago. And that it just makes me very happy because I know the struggles that she has been through and the pushbacks that she's also had. So those sorts of stories really make me happy. And another one would be a girl in her like mid-20s. She has endometriosis, adenomyosis, and fibromyalgia, which is basically their reception to pain is so much higher than the average person. And for someone who has two chronic illnesses, the amount of pain that she feels is just like unimaginable. And she was taking like having like the depot shots, taking the pill, and also had like the marina in, and her aim was to come off all of that. She wanted to focus on natural medicine. And after about a year of treatment, we slowly got her off little things, each medication one by one. And then she has now been having periods with not much pain at all and not on any medication. And yeah, that's something that has really stuck with me as well, because she felt very lost and like just being given so many different drugs. And she was like, I'm just so overtaking it. And now she has a quality of life back. And I think quality of life is a very also important outcome to strive for. Yeah. So those are two.
Well done. That's so awesome.
Thank you so much.
So what's a couple of tips that you can share with our community here that would help them from your perspective? What are those little things that they can do themselves at home?
Yeah. I think one of the main things is like never give up on your health goals. I think always believing in yourself, and even after each kickback, keep going until you find the answer. It can take years, but keep going until you get there. But I think sleep is super, super important. So it's like in this busy culture that we all have, people think, oh, sleep can wait. I can just drive off 3 hours. But sleep is where our cells rejuvenate overnight time. Our body does come out of that sympathetic nervous system and into rest and restore. So our functionality of all of our organs restores the next day. And I think being out in nature, it's not really given enough credit to. There's fresh air, there's vitamin D, there's exercise. So we're releasing endorphins in the body, getting blood flow and circulation to all of the organs. And it also really helps with emotional clarity and reflection. So I think nature is also a really holistic kind of like health tip too, because it's got everything it needs in it. And I think just not ignoring your mental health or how you feel. If you feel like you need assistance, need to talk to someone, look after that, because emotion doesn't just go away. Like it can manifest in physical disease. So I think that's a really big important one too.
Awesome. Good. Amazing tips. Thank you. Was there anything that you really wanted to share today that we haven't covered that you wanted to make sure you say before we finish up?
I don't think so. I think I've pretty much said everything, but yeah, basically just to never give up and to keep striving for what you want. And it's okay to also make new and fresh health goals as well. They can be different to the ones that you set last year if they no longer fit your lifestyle. You can change them and it's just all about growth. You never get to that perfect state. It's just always growing. Yeah.
Yeah, amazing. Thank you again, Maddy. I know the community is going to be definitely very enlightened by what you shared today. And I'm loving the practitioners that I'm bringing in that are really talking about this holistic approach. You know, we know in ourselves that we're not just a particular body part. We don't just need this one intervention and we're healed. It's just such a, whereas it's not to say that we need a complex system to heal us, but we do just need to think about it holistically and what are all the pieces that are going to fit together to help us be and get that quality of life. So thank you for sharing your perspective and your wisdom. I really appreciate it. Thank you, Maddy.
Oh, thank you. That's very kind. Happy to do so.
And feel free to pop how people can get in touch with you in the comments below when we post this in the group. I'll make sure to tag you so that people know how to get in contact with you as well.
Oh, cool. Thank you so much.
And Maddy.
Thank you.